Top 200 drugs practice. Brand generics, drug classes, and indications. These are the medications that appear again and again on exams. Don't try to memorize randomly. Learn them the smart way. A patient with a history of chronic kidney disease, CKD, and hypertension presents a new prescription for losartan. Which lab value should the pharmacy technician flag for the pharmacist's review before dispensing? Option A, serum sodium. Option B, serum potassium. Option C, serum calcium. Option D, serum magnesium. Correct answer, B. Losartan is an ARB that can cause hyperkalemia, especially in patients with renal impairment. Monitoring potassium is critical to avoid cardiac arrhythmias. Sodium, calcium, and magnesium are less directly affected by ARB therapy compared to potassium. A patient taking atorvastatin 40 mg daily reports to the pharmacy counter complaining of unexplained muscle pain and dark-colored urine. Which serious condition should the pharmacist be alerted to? Option A, hepatotoxicity. Option B, nephrolithiasis. Option C, rhabdomyolysis. Option D, Stevens-Johnson syndrome. Correct answer, C. Rhabdomyolysis is a rare but severe side effect of statins, like atorvastatin, characterized by muscle breakdown and myoglobinuria, dark urine. While hepatotoxicity is a concern with statins, muscle pain and dark urine specifically point toward muscle necrosis. A pharmacy technician is processing a refill for metformin. The patient mentions they are scheduled for a CT scan with intravenous contrast tomorrow. What is the standard safety recommendation for this patient? Option A, double the metformin dose the day of the procedure. Option B, take metformin as usual but increase fluid intake. Option C, hold metformin for 48 hours after the procedure. Option D, switch to glyburide for 3 days prior to the scan. Correct answer, C. Metformin must be held at the time of or prior to procedures involving iodinated contrast, and for 48 hours after, to prevent contrast-induced nephropathy and subsequent lactic acidosis. Which of the following drug-drug interactions represents a duplication of therapy that could lead to profound bradycardia? Option A, lisinopril and losartan. Option B, metoprolol and amlodipine. Option C, sertraline and citalopram. Option D, metoprolol and verapamil, a non-dihydropyridine CCB. Correct answer, D. Combining metoprolol, beta blocker, with heart rate lowering calcium channel blockers, like verapamil, causes additive effects on the SA and AV nodes, leading to dangerous bradycardia. Metoprolol and amlodipine, DHP-CCB, are frequently used together safely for BP control. A patient is prescribed levothyroxine, 125 micrograms. During counseling, the patient asks if they can take their carafate, sucralfate, at the same time. How should the technician advise the patient to schedule these? Option A, take them together on an empty stomach. Option B, take levothyroxine 4 hours before or after the carafate. Option C, take levothyroxine with dinner and carafate with breakfast. Option D, it doesn't matter as long as they are taken daily. Correct answer, B. Sucralfate, along with antacids and iron supplements, can significantly decrease the absorption of levothyroxine. A separation of at least 4 hours is required to ensure therapeutic thyroid levels. A patient hospitalized for a pulmonary embolism is being transitioned from an IV heparin drip to oral clopidogrel and aspirin. What is the primary mechanism of clopidogrel? Option A, inhibition of vitamin K epoxide reductase. Option B, inhibition of COX-1 and COX-2 enzymes. Option C, inhibition of ADP-induced platelet aggregation. Option D, binding to antithrombin 3. Correct answer, C. Clopidogrel is a P2Y12 inhibitor that prevents ADP from binding to its receptor on platelets. Aspirin inhibits COX-1, and warfarin inhibits vitamin K epoxide reductase. Which of the following pairs of medications poses the highest risk for causing serotonin syndrome if taken concurrently? Option A, sertraline and tramadol. Option B, gabapentin and sertraline. Option C, lisinopril and simvastatin. Option D, amoxicillin and prednisone. Correct answer, A. Sertraline is an SSRI, and tramadol has serotonergic activity. Combining them increases the risk of serotonin syndrome, characterized by agitation, hallucinations, and hyperthermia. Gabapentin does not significantly affect serotonin. A patient is picking up a prescription for albuterol HFA. They also mention they recently started taking metoprolol for heart palpitations. Why is this combination a potential safety concern? Option A, metoprolol increases the risk of albuterol-induced tremors. Option B, metoprolol may antagonize the bronchodilatory effect of albuterol. Option C, the combination causes severe hypokalemia. Option D, albuterol prevents metoprolol from lowering the blood pressure. Correct answer, B. Metoprolol is a beta blocker. Even though it is cardioselective, at higher doses it can block beta-2 receptors in the lungs, potentially causing bronchospasm or making albuterol, a beta-2 agonist, less effective. A patient taking furosemide, 40 mg BID, is at the highest risk for which electrolyte abnormality? Option A, hyperkalemia. Option B, hypokalemia. Option C, hypercalcemia. Option D, hypernatremia. Correct answer, B. Furosemide is a loop diuretic that causes the kidneys to excrete potassium, sodium, and water. Hypokalemia, low potassium, is a very common and dangerous side effect that often requires potassium supplementation. A patient presents a prescription for pantoprazole 40 mg. The profile shows they are currently taking clopidogrel 75 mg. Why might the pharmacist contact the prescriber? Option A, pantoprazole increases the risk of clopidogrel-induced GI bleeds. Option B, pantoprazole may reduce the conversion of clopidogrel to its active metabolite. Option C, clopidogrel causes the pantoprazole to be excreted too quickly. Option D, there is no interaction. These are commonly used together. Correct answer, B. Certain PPIs, especially omeprazole, and to a lesser extent pantoprazole, inhibit the CYP2C19 enzyme, which is required to convert the prodrug clopidogrel into its active form, potentially increasing the risk of cardiovascular events. What is the specific black box warning associated with the use of lisinopril? Option A, risk of tendon rupture. Option B, fetal toxicity, death during pregnancy. Option C, increased risk of suicidal ideation. Option D, severe hepatotoxicity. Correct answer, B. ACE inhibitors like lisinopril are strictly contraindicated in pregnancy category DX, because they act directly on the renin-angiotensin system, which can cause injury and death to the developing fetus. A patient is prescribed prednisone 10 mg for 14 days for a COPD exacerbation. Which side effect is a patient most likely to experience within the first few days of therapy? Option A, weight loss and hypoglycemia. Option B, hypotension and bradycardia. Option C, mood changes and increased appetite. Option D, osteoporosis and cataracts. Correct answer, C. Short-term corticosteroid use commonly causes steroid jitters, insomnia, mood swings, and increased appetite, blood glucose. Osteoporosis and cataracts are complications of long-term chronic use. Which medication in the following list is classified as a HMG-CoA reductase inhibitor? Option A, rosuvastatin. Option B, omeprazole. Option C, losartan. Option D, amlodipine. Correct answer, A. The statin class, rosuvastatin, atorvastatin, etc., works by inhibiting the enzyme HMG-CoA reductase, which is the rate-limiting step in cholesterol synthesis in the liver. A patient is taking simvastatin 80 mg daily. According to FDA safety communications, why is this specific dose generally avoided? Option A, it is no longer effective at that dose. Option B, it carries an increased risk of myopathy and rhabdomyolysis. Option C, it causes irreversible hearing loss. Option D, it must be taken with a high-fat meal to work. Correct answer B. The FDA restricted the use of the 80 mg dose of simvastatin due to the high incidence of muscle injury, myopathy, compared to lower doses or other statins. A patient with a history of a true penicillin allergy, anaphylaxis, presents a prescription for amoxicillin. What is the most appropriate action? Option A, dispense the medication as the allergy is likely old. Option B, suggest the patient take an antihistamine with the dose. Option C, flag the order and alert the pharmacist immediately. Option D, switch the medication to cephalexin automatically. Correct answer C. Amoxicillin is a penicillin. In a patient with a confirmed anaphylactic history, it is strictly contraindicated. The technician must stop the process and alert the pharmacist to contact the physician for an alternative, like a macrolide. Which of the following is a common side effect of amlodipine that often leads patients to discontinue the medication? Option A, dry hacking cough. Option B, peripheral edema. Option C, night sweats. Option D, metallic taste. Correct answer, B. Amlodipine, a dihydropyridine calcium channel blocker, causes vasodilation, which frequently results in swelling of the hands, ankles, and feet, peripheral edema. Dry cough is associated with ACE inhibitors like lisinopril. A patient is prescribed montelukast for asthma. When is the optimal time of day for the patient to take this medication? Option A, in the morning to prevent daytime triggers. Option B, in the evening. Option C, only when they feel an asthma attack starting. Option D, 30 minutes before exercise only. Correct answer, B. For asthma, montelukast singulaire is most effective when taken in the evening. It is a maintenance medication, not a rescue inhaler, and should be taken daily regardless of symptoms. A patient is taking both escitalopram and aspirin 81 mg. What is the primary safety concern regarding this combination? Option A, reduced effectiveness of escitalopram. Option B, increased risk of GI bleed or systemic bleeding. Option C, severe hypertension, hypertensive crisis. Option D, kidney stone formation. Correct answer B. SSRIs like escitalopram affect platelet aggregation. When combined with antiplatelet agents like aspirin, the risk of gastrointestinal bleeding is significantly increased. Which medication would be most appropriate for a patient needing as-needed relief for an acute asthma attack? Option A, montelukast. Option B, albuterol. Option C, prednisone. Option D, salmeterol. Correct answer. B. Albuterol is a short-acting beta agonist, SABA, and is the only rescue medication listed. Montelukast and prednisone are for maintenance or long-term inflammation control and do not provide immediate bronchodilation. A patient currently taking sertraline is diagnosed with a severe infection and prescribed linezolid. Why is this a major D-level danger interaction? Option A, linezolid decreases the levels of sertraline. Option B, both drugs cause severe nephrotoxicity. Option C, linezolid has MAOI properties and can trigger serotonin syndrome. Option D, sertraline prevents the antibiotic from working. Correct answer, C. Linezolid is a weak, reversible MAO inhibitor. Combining it with an SSRI like sertraline can lead to toxic levels of serotonin, resulting in serotonin syndrome. A patient is prescribed gabapentin 300 mg TID for postherpetic neuralgia. Which side effect should the patient be warned about regarding coordination? Option A, tachycardia. Option B, ataxia and somnolence. Option C, urinary retention. Correct answer, B. Gabapentin commonly causes CNS depression, leading to somnolence, drowsiness, and ataxia, loss of coordination, dizziness, which increases the risk of falls, especially in the elderly. Hydrochlorothiazide, HCTZ, should be used with caution in patients with a history of which painful joint condition? Option A, rheumatoid arthritis. Option B, osteoarthritis. Option C, gout. Option D, septic arthritis. Correct answer, C. Thiazide diuretics like HCTZ can increase serum uric acid levels, which can precipitate a gout flare in susceptible patients. A patient is taking lisinopril, 20 mg, and spironolactone, a potassium-sparing diuretic. Which side effect is most likely to occur due to this combination? Option A, hypokalemia. Option B, hyperkalemia. Option C, hyponatremia. Option D, hypocalcemia. Correct answer, B. Both ACE inhibitors, lisinopril, and potassium-sparing diuretics, spironolactone, cause the body to retain potassium. Using them together creates a synergistic effect that significantly increases the risk of hyperkalemia. What is the maximum daily dose of acetaminophen for a healthy adult to avoid the risk of hepatotoxicity? Option A, 2,000 mg. Option B, 3,000 mg. Option C, 4,000 mg. Option D, 6,000 mg. Correct answer, C. While some manufacturers recommend 3,000 mg to be safe, the FDA/standard clinical limit for a healthy adult is 4,000 milligrams, 4 grams, in a 24-hour period. A patient is being switched from citalopram to a different class of antidepressants. What is the standard washout period required to prevent drug interactions? Option A, 24 hours. Option B, 72 hours. Option C, 14 days. Option D, 30 days. Correct answer, C. When switching between SSRIs, SNRIs, and MAOIs, a 14-day washout period is generally required to ensure the drug has cleared the system to avoid serotonin syndrome. A patient is prescribed tamsulosin 0.4 milligrams daily for BPH. Which of the following is a critical first dose counseling point for this patient? Option A. Take the medication with a high-fat meal to increase absorption. Option B. Be cautious of sudden drops in blood pressure when standing up. Option C. This medication will likely cause significant urinary retention. Option D. You should expect your heart rate to increase significantly. Correct answer, B. Tamsulosin is an alpha-1 blocker. While it is more selective for the prostate, alpha-1A, it can still cause orthostatic hypotension, the first dose phenomenon, leading to dizziness or fainting upon standing. A patient with a history of a sulfa allergy is prescribed glipizide for type 2 diabetes. What is the pharmacological basis for concern in this scenario? Option A. Glipizide is a biguanide that cross-reacts with sulfonamides. Option B. Sulfonylureas contain a structural component similar to sulfonamide antibiotics. Option C. Glipizide increases the renal clearance of sulfa drugs. Option D. There is no concern. Sulfonylureas do not interact with sulfa allergies. Correct answer, B. Glipizide and glyburide are sulfonylureas. They contain a sulfonamide moiety. While cross-reactivity is debated, it is traditionally considered a contraindication or a point of high caution in patients with severe sulfa allergies. Which of the following insulin types is considered peakless and should never be mixed in the same syringe with other insulins? Option A, insulin lispro. Option B, insulin glargine. Option C, Humulin R. Option D, Novolin N. Correct answer B. Insulin glargine lantus is a long-acting basal insulin designed to have a steady, peakless 24-hour effect. Its acidic pH, 4.0, causes it to precipitate if mixed with other insulins, which would alter its absorption profile. A patient taking warfarin is prescribed azithromycin for a sinus infection. What is the most likely clinical outcome of this interaction? Option A. Increased risk of thrombosis due to decreased INR. Option B. Increased risk of bleeding due to an increased INR. Option C. Decreased effectiveness of azithromycin. Option D. No interaction occurs between macrolides and warfarin. Correct answer, B. Most antibiotics, including the macrolide azithromycin, can increase the effects of warfarin by altering gut flora, which produce vitamin K, or by inhibiting CYP enzymes, leading to an increased international normalized ratio, INR, and bleeding risk. A patient is currently taking duloxetine for MDD and is now prescribed meloxicam for osteoarthritis. What is the primary safety concern for this combination? Option A. Increased risk of serotonin syndrome. Option B. Increased risk of gastrointestinal bleeding. Option C. Decreased efficacy of meloxicam. Option D. Potential for hypertensive crisis. Correct answer, B. Both SNRIs, like duloxetine, and SSRIs inhibit serotonin uptake in platelets, which impairs their ability to aggregate. When combined with NSAIDs, like meloxicam, the risk of upper GI bleeds is significantly compounded. A patient presents a prescription for alprazolam. Which of the following auxiliary labels is most essential for this medication? Option A, take with a full glass of orange juice. Option B, may cause photosensitivity, avoid sunlight. Option C, may cause drowsiness. Alcohol may intensify this effect. Option D, take on an empty stomach 1 hour before meals. Correct answer, C. Alprazolam is a benzodiazepine, C4. Its primary side effect is CNS depression. Alcohol is also a CNS depressant. Combining them can lead to respiratory depression, extreme sedation, and death. Which of the following medications is classified as an alpha-beta blocker and is uniquely indicated for both hypertension and congestive heart failure, CHF? Option A, metoprolol. Option B, carvedilol. Option C, lisinopril. Option D, amlodipine. Correct answer, B. Carvedilol blocks alpha-1, beta-1, and beta-2 receptors. Unlike pure beta blockers, its alpha-blocking property provides vasodilation, which is highly beneficial in treating heart failure by reducing afterload. A patient taking fluoxetine 20 mg daily is prescribed sumatriptan for a migraine. What rare but serious condition should the pharmacist monitor for? Option A, rhabdomyolysis. Option B, serotonin syndrome. Option C, nephrotoxicity. Option D, Stevens-Johnson syndrome. Correct answer, B. Fluoxetine is an SSRI and triptans are serotonin agonists. Combining drugs that increase serotonin levels or activity increases the risk of serotonin syndrome, characterized by tremors, hyperthermia, and agitation. A patient is prescribed bupropion XL for smoking cessation. Which pre-existing condition would be a contraindication for this medication? Option A, hypertension. Option B, type 2 diabetes. Option C, seizure disorder. Option D, chronic bronchitis. Correct answer, C. Bupropion lowers the seizure threshold. It is strictly contraindicated in patients with a history of seizure disorders or eating disorders, bulimia, anorexia, as these patients are at a much higher risk for seizures. Which of the following benzodiazepines has the longest half-life and is most likely to cause hangover effects in elderly patients? Option A, alprazolam. Option B, lorazepam. Option C, clonazepam. Option D, midazolam. Correct answer, C. Clonazepam Klonopin has a significantly longer half-life, up to 50 hours, compared to alprazolam or lorazepam. Long-acting benzodiazepines are generally avoided in the elderly due to the risk of accumulation, leading to falls and cognitive impairment. A patient is prescribed venlafaxine for generalized anxiety disorder. What vital sign must be monitored regularly due to the drug's mechanism of action? Option A, heart rate. Option B, blood pressure. Option C, respiratory rate. Option D, body temperature. Correct answer, B. Venlafaxine is an SNRI. At higher doses, the inhibition of norepinephrine reuptake can lead to dose-dependent increases in blood pressure. A patient presents a prescription for cyclobenzaprine. Upon review, the patient is also taking amitriptyline. What is the risk associated with this combination? Option A, excessive anticoagulation. Option B, additive anticholinergic effects and CNS depression. Option C, sudden drop in blood glucose levels. Option D, acute renal failure. Correct answer B. Cyclobenzaprine is structurally similar to tricyclic antidepressants, TCAs, like amitriptyline. Taking both increases the risk of anticholinergic toxidrome, dry mouth, blurred vision, urinary retention, and severe sedation. Which of the following medications is a non-sedating antihistamine that is actually a metabolite of hydroxyzine? Option A, cetirizine. Option B, loratadine. Option C, diphenhydramine. Option D, fexofenadine. Correct answer, A. Cetirizine, Zyrtec, is the active metabolite of hydroxyzine Vistaril atarax. While cetirizine is considered second generation and less sedating than hydroxyzine, it still carries a higher risk of drowsiness than loratadine. A patient is prescribed pioglitazone. Which of the following black box warnings is associated with this medication? Option A, increased risk of bladder cancer. Option B, risk of lactic acidosis. Option C, exacerbation of congestive heart failure, CHF. Option D, increased risk of thyroid C-cell tumors. Correct answer, C. Thiazolidinediones, TZDs, like pioglitazone, cause fluid retention, which can worsen or lead to heart failure. Lactic acidosis is the BBW for metformin, and thyroid tumors are associated with GLP-1 agonists. Which of the following pairs contains a rapid-acting insulin and its correct administration timing? Option A, insulin glargine 15 minutes before meals. Option B, insulin Lispro 15 minutes before or immediately after meals. Option C, insulin Lisprom 60 minutes before meals. Option D, Humulin N at bedtime. Correct answer, B. Insulin Lispro, Humalog, is rapid-acting. It has an onset of 15 minutes, so it must be administered close to mealtime to prevent hypoglycemia. A patient with chronic obstructive pulmonary disease, COPD, is prescribed diphenhydramine for allergies. Why might this be problematic? Option A, it causes excessive thinning of mucus. Option B, its anticholinergic effects can thicken bronchial secretions, making them harder to clear. Option C, it causes bronchodilation that interferes with inhalers. Option D, it stimulates the cough reflex. Correct answer, B. First-generation antihistamines like diphenhydramine have strong anticholinergic properties. In patients with respiratory diseases like COPD or asthma, this can dry out and thicken mucus, leading to airway obstruction. Which of the following is a common side effect of sitagliptin, Januvia? Option A, weight gain. Option B, nasopharyngitis, upper respiratory tract infection. Option C, hypoglycemia, when used as monotherapy. Correct answer, B. Sitagliptin, a DPP-4 inhibitor, is generally weight neutral and has a low risk of hypoglycemia when used alone. However, common side effects reported in trials include nasopharyngitis and headaches. Trazodone is frequently prescribed off-label for which condition? Option A, hypertension. Option B, insomnia. Option C, neuropathic pain. Option D, smoking cessation. Correct answer, B. While trazodone is classified as an antidepressant, SERI, its potent sedative effects at low doses, 50 to 100 milligrams, make it a very common choice for treating insomnia. Which medication is most likely to cause priapism, a medical emergency involving a prolonged erection? Option A, tamsulosin. Option B, alprazolam. Option C, trazodone. Option D, warfarin. Correct answer, C. Trazodone is famously associated with priapism, sometimes nicknamed trazobone in medical circles to help students remember this rare but serious side effect. A patient taking warfarin is told to maintain a consistent intake of spinach and kale. Why is this counseling necessary? Option A. These foods increase the absorption of warfarin. Option B. These foods are high in vitamin K, which antagonizes the effect of warfarin. Option C. These foods are high in vitamin E, which increases bleeding risk. Option D. These foods cause the liver to metabolize warfarin faster. Correct answer, B. Warfarin works by inhibiting vitamin K-dependent clotting factors. Sudden increases in dietary vitamin K, found in leafy greens, will override the drug, lowering the INR and increasing the risk of clots. Consistency is key. Which of the following medications is an SNRI used for both depression and fibromyalgia? Option A, fluoxetine. Option B, duloxetine. Option C, bupropion. Correct answer, B. Duloxetine Cymbalta is FDA approved for major depressive disorder, generalized anxiety disorder, diabetic peripheral neuropathy, and fibromyalgia. A patient is taking glyburide for diabetes. They are started on a beta blocker for hypertension. What is the primary safety concern? Option A. The beta blocker will cause the glyburide to stop working. Option B. The beta blocker can mask the symptoms of hypoglycemia, like tachycardia. Option C. The combination causes severe hyperglycemia. Option D. The patient will experience a severe skin rash. Correct answer, B. Beta blockers can mask the autonomic warning signs of low blood sugar, such as tremors and rapid heartbeat, tachycardia. Sweating is usually the only symptom not masked. Amitriptyline belongs to which drug class? Option A, SSRI. Option B, SNRI. Option C, tricyclic antidepressant, TCA. Option D, MAOI. Correct answer, C. Amitriptyline is a TCA. This class is known for having a narrow therapeutic index and significant side effects, including sedation and anticholinergic activity. Which of the following medications is used to treat both anxiety and itching, pruritus? Option A, loratadine. Option B, hydroxyzine. Option C, alprazolam. Option D, duloxetine. Correct answer, B. Hydroxyzine, Vistaril atarax, is a first-generation antihistamine with H1 antagonist and CNS depressant properties, making it useful for both allergic reactions, itching, and acute anxiety. A patient taking lorazepam for sleep reports feeling excessively groggy the next morning. This is an example of Option A, an idiosyncratic reaction, Option B, a residual drug effect, hangover effect, Option C, an allergic reaction, Option D, drug-induced Parkinsonism. Correct answer B. Because benzodiazepines affect the CNS, they can often cause morning-after impairment, particularly if the dose is too high or the half-life of the drug extends into the waking hours. A patient is picking up a prescription for ciprofloxacin. Which of the following counseling points is most critical regarding a potential black box warning for this class? Option A. Avoid driving due to extreme drowsiness. Option B. Report any sudden pain or swelling in the back of the ankle. Option C. Take with an antacid to prevent stomach upset. Option D. Use a tanning bed to increase vitamin D absorption. Correct answer B. Fluoroquinolones like ciprofloxacin carry a black box warning for tendinitis and tendon rupture, most commonly the Achilles tendon. Antacids actually decrease its absorption, and photosensitivity is a side effect, not a reason to use a tanning bed. A patient presents a prescription for nitrofurantoin, macrobid, for a UTI. Which of the following conditions in the patient's profile would be a contraindication for this medication? Option A, hypertension. Option B, renal impairment, CRCL less 30 milliliters per minute. Option C, penicillin allergy. Correct answer B. Nitrofurantoin requires adequate renal function to reach therapeutic concentrations in the urine. It is generally contraindicated in patients with a creatinine clearance, CRCL, less than 30 to 60 milliliters per minute, depending on the guideline, as it will be ineffective and potentially toxic. A patient is prescribed metronidazole for a vaginal infection. Which specific lifestyle modification must the technician emphasize during the sale? Option A. Avoid all alcohol consumption during and for 3 days after therapy. Option B. Avoid dairy products for the duration of treatment. Option C. Take the medication only with grapefruit juice. Option D. Stay upright for at least 30 minutes after taking the dose. Correct answer A. Metronidazole causes a disulfiram-like reaction when combined with alcohol, resulting in severe nausea, vomiting, flushing, and tachycardia. This restriction extends to 72 hours after the last dose is taken. Which of the following medications requires the auxiliary label, "Finish all this medication unless otherwise directed by prescriber," to prevent antimicrobial resistance? Option A, ondansetron. Option B, doxycycline. Option C, loperamide. Correct answer B. Doxycycline is an antibiotic. It is essential to complete the full course of antibiotics to ensure the infection is fully eradicated and to prevent the development of drug-resistant bacteria. A patient taking warfarin is prescribed sulfamethoxazole, trimethoprim, Bactrim, for a skin infection. What is the most likely result of this interaction? Option A. The patient will experience a significant drop in INR. Option B. The patient will experience a significant increase in INR and bleeding risk. Option C. The Bactrim will become less effective. Option D. The patient will develop a severe vitamin D deficiency. Correct answer B. Bactrim is a potent inhibitor of the metabolism of warfarin. This interaction leads to a rapid and dangerous increase in the international normalized ratio, INR, significantly increasing the risk of life-threatening bleeding. A patient is prescribed doxycycline for acne. Which of the following is a common side effect that requires an auxiliary label? Option A may cause orange discoloration of urine. Option B, avoid prolonged exposure to sunlight. Option C, take with a large glass of milk. Option D, do not take if you have a history of gout. Correct answer, B. Tetracyclines, including doxycycline, cause photosensitivity, making patients more susceptible to severe sunburns. Dairy products, calcium, should be avoided within 2 hours of dosing, as they chelate the drug and reduce absorption. Which medication is the drug of choice for the prevention and treatment of oral candidiasis? Thrush. Option A, oseltamivir. Option B, nystatin. Option C, valacyclovir. Option D, metronidazole. Correct answer, B. Nystatin is an antifungal, often prescribed as a swish and swallow suspension to treat fungal infections of the mouth and throat. A mother is picking up a prescription for cefazolin, a cephalosporin. She mentions her child had hives and difficulty breathing after taking amoxicillin. What should the technician do? Option A, process the prescription as they are in different classes. Option B, alert the pharmacist to a potential cross-sensitivity. Option C, tell the mother to give the child Benadryl before each dose. Option D, suggest the mother use a lower dose than prescribed. Correct answer B. There is a 1% to 10% cross-sensitivity between penicillins like amoxicillin and cephalosporins. In a patient with a history of anaphylaxis or hives, type 1 hypersensitivity, cephalosporins should be avoided or used with extreme caution. Which of the following medications is a prodrug that is converted to acyclovir after oral administration to improve bioavailability? Option A, valacyclovir. Option B, oseltamivir. Option C, fluconazole. Option D, ketoconazole. Correct answer, A. Valacyclovir is a prodrug of acyclovir. It is better absorbed in the GI tract, allowing for less frequent dosing than acyclovir for the treatment of shingles or herpes. A patient is prescribed promethazine for nausea. Which of the following is a serious safety concern for this medication, specifically in pediatric patients under age 2? Option A, permanent tooth discoloration. Option B, severe respiratory depression. Option C, acute kidney failure. Option D, excessive hair growth. Correct answer, B. Promethazine has a black box warning against use in children under 2 years of age because it can cause fatal respiratory depression. Which of the following medications works by increasing the amount of water and fat absorbed into the stool, acting as a stool softener? Option A, senna. Option B, polyethylene glycol. Option C, docusate. Option D, loperamide. Correct answer, C. Docusate sodium is a surfactant laxative, stool softener. Senna is a stimulant, and polyethylene glycol is an osmotic laxative. A patient is prescribed levofloxacin for pneumonia. Which of the following should they avoid taking at the same time as their dose? Option A, acetaminophen. Option B, multivitamins with iron. Option C, loratadine. Option D, guaifenesin. Correct answer, B. Multivalent cations, iron, calcium, magnesium, aluminum, chelate with fluoroquinolones like levofloxacin, significantly reducing their absorption and effectiveness. Which of the following GI medications is an osmotic laxative commonly used for bowel prep before a colonoscopy? Option A, loperamide. Option B, polyethylene glycol. Option C, prochlorperazine. Option D, metronidazole.
Correct answer B. Polyethylene glycol, Miralax Golightly, works by drawing water into the colon via osmosis to induce a bowel movement.
A patient is picking up a prescription for ondansetron ODT. What does ODT stand for, and how should it be administered? Option A, oral daily tablet, swallow with food. Option B, orally disintegrating tablet, allowed to dissolve on the tongue. Option C, on-demand treatment, take only when vomiting occurs. Option D, overdose therapy, used only in emergencies. Correct answer B. ODT stands for orally disintegrating tablet. These are designed to dissolve quickly on the tongue without the need for water, which is helpful for patients experiencing severe nausea. Which of the following medications is an antifungal that is often given as a single 150 mg dose for vaginal yeast infections? Option A, metronidazole. Option B, fluconazole. Option C, clindamycin. Option D, acyclovir. Correct answer B. Fluconazole diflucan is a common triazole antifungal. A single 150 mg oral dose is the standard treatment for uncomplicated vaginal candidiasis.
A patient is prescribed clindamycin for a dental infection. They are warned to contact their doctor if they experience severe watery diarrhea. What condition are they being screened for? Option A, diverticulitis. Option B, Clostridioides difficile, C. diff infection. Option C, lactose intolerance. Option D, gastroesophageal reflux disease. Correct answer B. Clindamycin is notoriously associated with causing C. diff-associated diarrhea, CDAD, because it wipes out normal gut flora, allowing C. diff to overgrow and release toxins. Which of the following is an inhaled corticosteroid used for the long-term maintenance of asthma? Option A, fluticasone. Option B, prednisolone. Option C, albuterol. Option D, cetirizine. Correct answer A. Fluticasone flovent flonase is a corticosteroid. When inhaled, it reduces inflammation in the airways. Albuterol is a bronchodilator rescue, not a steroid. A patient is taking prednisolone. What is the most appropriate advice to give a patient when they are finishing a long-term course of this medication? Option A. Stop the medication immediately once you feel better. Option B. Taper the dose gradually as directed by the physician. Option C. Double the last dose to ensure the infection is gone. Option D. Switch to ibuprofen for the last 3 days. Correct answer B. Long-term steroid use suppresses the body's natural cortisol production. Stopping abruptly can lead to adrenal crisis. Therefore, the dose must be tapered slowly. Which of the following is a stimulant laxative that may cause harmless reddish-brown discoloration of the urine? Option A, docusate. Option B, senna. Option C, polyethylene glycol. Option D, loperamide. Correct answer B. Senna is a stimulant laxative derived from plants. It can cause melanosis coli, darkening of the colon wall, and a change in urine color.
For a patient to receive the maximum benefit from oseltamivir, Tamiflu, within how many hours of symptom onset should therapy begin? Option A, 12 hours. Option B, 48 hours. Option C, 72 hours. Option D, 1 week. Correct answer, B. Oseltamivir is most effective at shortening the duration of the flu when started within 48 hours of the first symptoms. Which medication is a topical antifungal cream commonly used for athlete's foot? Tinea pedis. Option A, miconazole. Option B, valacyclovir. Option C, mupirocin. Option D, hydrocortisone. Correct answer, A. Miconazole monostat mycotin is an imidazole antifungal used topically for various fungal skin infections. A patient is prescribed prochlorperazine for severe nausea. To which class of medications does this belong, which may also cause extrapyramidal symptoms, EPS? Option A, SSRIs. Option B, phenothiazines. Option C, benzodiazepines. Option D, 5-HT3 antagonists. Correct answer, B. Prochlorperazine, compazine, is a phenothiazine. Like antipsychotics in the same class, it blocks dopamine receptors and can cause movement disorders, EPS, like dystonia. Which of the following medications is an antidiarrheal that is an opioid agonist but does not cross the blood-brain barrier at normal doses? Option A, diphenoxylate. Option B, loperamide. Option C, docusate. Option D, bismuth subsalicylate. Correct answer, B. Loperamide Imodium acts on the mu-opioid receptors in the gut to slow motility, but lacks CNS effects at therapeutic doses, making it a non-controlled substance. A patient is prescribed budesonide Pulmicort for asthma. Why should the patient be instructed to rinse their mouth after each use? Option A, to prevent the medication from staining their teeth. Option B, to prevent the development of oral candidiasis, thrush. Option C, to remove the bitter taste of the medication. Option D, to ensure the medication is swallowed into the stomach. Correct answer, B. Local deposition of inhaled corticosteroids in the mouth can suppress local immunity, leading to fungal overgrowth, thrush. Rinsing and spitting after use prevents this. Which antibiotic is commonly used to treat traveler's diarrhea and is known to cause a metallic taste in the mouth? Option A, cephalexin. Option B, metronidazole. Option C, azithromycin. Option D, amoxicillin. Correct answer, B. Metronidazole is often used for GI infections and is frequently associated with a metallic taste, dysgeusia, as a side effect. A patient is prescribed alendronate, 70 mg once weekly for osteoporosis. Which administration instruction is vital to prevent esophageal erosion? Option A, take with a meal to improve absorption. Option B, take with at least 8 ounces of plain water and remain upright for 30 minutes. Option C, take at bedtime with a glass of milk. Option D, crush the tablet and mix it with applesauce if it is too large to swallow. Correct answer, B. Alendronate is a bisphosphonate that can cause severe esophageal irritation. It must be taken with plain water, not juice or coffee, on an empty stomach, and the patient must remain upright to ensure the tablet does not reflux into the esophagus. A patient with hepatic encephalopathy is prescribed lactulose. While this is a laxative, what is the primary clinical goal of therapy in this specific patient? Option A, to treat chronic constipation. Option B, to acidify the colon and convert ammonia to ammonium for excretion. Option C, to stimulate the release of bile from the gallbladder. Option D, to prevent the absorption of dietary fats.
Correct answer, B. In hepatic encephalopathy, the liver cannot clear ammonia. Lactulose acidifies the gut, which traps ammonia, NH3, by converting it to ammonium NH4+, which is then excreted via bowel movements. A patient taking sildenafil for erectile dysfunction is rushed to the ER with chest pain. Which medication is strictly contraindicated in this emergency? Option A, aspirin. Option B, nitroglycerin. Option C, heparin. Option D, morphine. The answer is option B, nitroglycerin. Correct answer, B. Sildenafil, a PDE5 inhibitor, potentiates the hypotensive effects of nitrates like nitroglycerin. Concurrent use can lead to a fatal drop in blood pressure. A patient is starting phenytoin for seizure control. Which of the following side effects is a common long-term complication involving the oral cavity? Option A, xerostomia, dry mouth. Option B, gingival hyperplasia. Option C, glossitis. Option D, oral candidiasis. Correct answer, B. Gingival hyperplasia, overgrowth of gum tissue, is a well-known side effect of long-term phenytoin use. Strict oral hygiene can mitigate, but not always prevent this. A patient presents a new prescription for lamotrigine. The pharmacist insists on a very slow dose titration, escalation. What life-threatening condition are they trying to avoid? Option A, acute myocardial infarction. Option B, Stevens-Johnson syndrome, SJS. Option C, serotonin syndrome. Correct answer, B. Lamotrigine carries a black box warning for serious rashes, including Stevens-Johnson syndrome and toxic epidermal necrolysis. The risk is significantly reduced by starting with a low dose and increasing it slowly. Which of the following medications is an antiepileptic that is also FDA approved for the prophylaxis of migraine headaches? Option A, levetiracetam. Option B, topiramate. Option C, phenytoin. Option D, lactulose. Correct answer, B. Topiramate Topamax is used for seizure disorders and is a first-line agent for preventing migraine attacks. Levetiracetam and phenytoin are generally only used for seizures. A patient taking methotrexate for rheumatoid arthritis is prescribed a supplement to take once weekly, usually the day after their dose, to reduce side effects. What is this supplement? Option A, vitamin B12. Option B, folic acid. Option C, vitamin D. Option D, calcium carbonate. Correct answer B. Methotrexate is a folate antimetabolite. Folic acid supplementation helps reduce GI toxicity, mouth sores, and liver toxicity associated with methotrexate therapy. Which of the following medications is a xanthine oxidase inhibitor used for the chronic prevention of gout attacks? Option A, colchicine. Option B, allopurinol. Option C, famotidine. Option D, bisacodyl. Correct answer, B. Allopurinol prevents the production of uric acid by inhibiting the enzyme xanthine oxidase. Colchicine is primarily used for acute flares or short-term prophylaxis. A patient is prescribed dicyclamine 20 mg QID. What is the primary indication for this medication? Option A, overactive bladder. Option B, irritable bowel syndrome IBS cramping. Option C, gastroesophageal reflux disease, GERD. Option D, chronic constipation. Correct answer, B. Dicyclamine bentyl is an antispasmodic, anticholinergic used specifically to treat GI smooth muscle spasms associated with IBS. A patient taking carbamazepine for trigeminal neuralgia should be monitored for which of the following electrolyte imbalances? Option A, hypernatremia. Option B, hyponatremia. Option C, hyperkalemia. Option D, hypocalcemia. Correct answer, B. Carbamazepine can cause SIADH, syndrome of inappropriate antidiuretic hormone, which leads to water retention and a dilution of serum sodium, hyponatremia. Which medication is a 5-alpha reductase inhibitor used to shrink an enlarged prostate, BPH, and can take up to 6 months to show full effect? Option A, tamsulosin. Option B, finasteride. Option C, oxybutynin. Option D, mirabegron. Correct answer, B. Finasteride Proscar inhibits the conversion of testosterone to DHT, physically shrinking the prostate over time. Tamsulosin is an alpha blocker that works much faster by relaxing smooth muscle. A patient is taking valproic acid, which lab value is most critical to monitor due to the drug's potential for serious toxicity. Option A, serum creatinine. Option B, liver function tests, LFTs. Option C, thyroid stimulating hormone, TSH. Option D, serum glucose. Correct answer, B. Valproic acid has black box warnings for hepatotoxicity and pancreatitis. Regular monitoring of LFTs is required, especially during the first 6 months of treatment. Which of the following is an over-the-counter H2 receptor antagonist, H2RA, used to treat heartburn? Option A, esomeprazole. Option B, famotidine. Option C, sucralfate. Option D, dicyclamine. Correct answer, B. Famotidine pepsid is an H2RA. Esomeprazole is a proton pump inhibitor, PPI. Sucralfate is a mucosal protectant. A patient is prescribed colchicine for an acute gout flare. What is a common dose-limiting side effect that tells the patient they have taken enough? Option A, severe diarrhea. Option B, tinnitus. Option C, insomnia. Correct answer, A. GI distress, specifically severe diarrhea, is a very common side effect of colchicine and often limits the amount a patient can tolerate during an acute attack. A patient is using oxybutynin patches for overactive bladder. What is the most likely side effect they will experience due to its drug class? Option A, diarrhea. Option B, excessive salivation. Option C, blurred vision and dry mouth. Option D,
bradycardia.
Correct answer, C. Oxybutynin is an anticholinergic. Anti-slut effects, dry mouth, dry eyes, urinary retention, constipation, and blurred vision are classic side effects of this class. Which of the following is a beta-3 adrenergic agonist used for overactive bladder that does not typically cause the dry mouth seen with anticholinergics? Option A, tolterodine. Option B, mirabegron. Option C, oxybutynin. Option D, finasteride. Correct answer, B. Mirabegron, Myrbetriq, relaxes the detrusor muscle by stimulating beta-3 receptors, offering an alternative for patients who cannot tolerate the anticholinergic side effects of drugs like tolterodine. A patient is taking hydroxychloroquine for lupus. Which regular screening is recommended due to potential long-term drug toxicity? Option A, audiogram, hearing test. Option B, ophthalmologic, eye exam. Option C, bone density scan. Option D, pulmonary function test. Correct answer, B. Hydroxychloroquine can cause retinal toxicity, retinopathy, which may be irreversible. Patients on long-term therapy require baseline and periodic eye exams. A female pharmacy technician who is pregnant is cautioned against handling crushed or broken tablets of which medication due to the risk of birth defects in a male fetus? Option A, methotrexate. Option B, finasteride. Option C, carbamazepine. Option D, allopurinol. Correct answer, B. Finasteride can be absorbed through the skin. It inhibits DHT, which is essential for the development of male fetal genitalia, posing a significant risk to pregnant women handling the drug. Which medication works by forming a paste-like slurry in the stomach that binds to the surface of ulcers to protect them from acid? Option A, ranitidine. Option B, esomeprazole. Option C, sucralfate. Option D, lactulose. Correct answer, C. Sucralfate, carafate, is a complex of aluminum hydroxide and sulfated sucrose. It acts locally by coating ulcers, rather than changing the pH of the stomach. A patient with a history of heart disease is prescribed sumatriptan for migraines. Why is this a major safety concern? Option A, it causes significant thinning of the blood. Option B, it is a vasoconstrictor and can cause coronary artery vasospasm or MI. Option C, it prevents the absorption of heart medications. Option D, it causes dangerous drops in heart rate. Correct answer, B. Triptans work by constricting blood vessels. This effect is not limited to the brain and can cause vasospasm in the coronary arteries, making it contraindicated in patients with ischemic heart disease or uncontrolled hypertension. Which of the following antiepileptic drugs is a known enzyme inducer, which often lowers the effectiveness of oral contraceptives? Option A, levetiracetam. Option B, valproic acid. Option C, carbamazepine. Option D, gabapentin. Correct answer, C. Carbamazepine is a potent inducer of CYP450 enzymes. It increases the metabolism of many other drugs, including hormonal contraceptives, often leading to unplanned pregnancies. A patient is taking bisacodyl tablets for occasional constipation. What is the mechanism of action for this drug? Option A, it draws water into the stool via osmosis.
Option B, it irritates the nerve plexus of the intestinal wall to cause contraction, stimulant. Option C, it lowers the surface tension of the stool, softener. Option D, it provides bulk to the stool using fiber. Correct answer, B. Bisicodyl dulcolax is a stimulant laxative. It directly stimulates the enteric nervous system to increase peristalsis. A patient is prescribed topiramate. Which of the following is a common cognitive side effect that patients often describe as brain fog or difficulty finding words? Option A, hyperreflexia. Option B, paresthesia. Option C, psychomotor slowing, word-finding difficulty. Option D, visual hallucinations. Correct answer, C. Topiramate is frequently associated with cognitive impairment, memory issues, and word-finding difficulties, sometimes jokingly referred to as Dopamax by patients. Which of the following is a proton pump inhibitor, PPI, available as an isomer of omeprazole? Option A, esomeprazole. Option B, famotidine. Option C, ranitidine. Option D, pantoprazole. Correct answer, A. Esomeprazole, Nexium, is the S enantiomer of omeprazole. While both are PPIs, esomeprazole is marketed as having slightly different metabolic properties. A patient presents a prescription for methotrexate 15 milligrams. How is this medication typically dosed for rheumatoid arthritis? Option A, 15 milligrams 3 times daily. Option B, 15 milligrams once weekly. Option C, 15 milligrams every morning. Option D, 15 milligrams only during a flare-up. Correct answer, B. For inflammatory conditions like RA or psoriasis, methotrexate is dosed weekly. Dosing it daily is a common and potentially fatal medication error that leads to severe bone marrow suppression. A patient is prescribed ibandronate 150 milligrams once monthly. To ensure proper absorption and safety, what is the minimum duration the patient must remain upright after administration? Option A, 15 minutes. Option B, 30 minutes. Option C, 60 minutes. Option D, 2 hours. Correct answer, C. While most oral bisphosphonates like alendronate and risedronate require staying upright for 30 minutes, ibandronate, Boniva, requires a minimum of 60 minutes to prevent severe esophageal irritation and ensure absorption. A patient with chronic kidney disease, CKD, is prescribed calcitriol. What is the primary difference between calcitriol and ergocalciferol, vitamin D2? Option A, calcitriol is the active form, 1,25-dihydroxyvitamin D3, and does not require renal activation. Option B, ergocalciferol is more potent and used only for acute toxicity. Option C, calcitriol is only available as an injectable formulation. Option D, ergocalciferol is the only version that can be taken with food. Correct answer, A. In CKD, the kidneys cannot convert inactive vitamin D to its active form. Calcitriol is already active, making it essential for patients with impaired renal function to maintain calcium homeostasis. A patient is taking ferrous sulfate, 325 milligrams TID, for anemia. Which common beverage should the pharmacy technician advise the patient to avoid within 2 hours of their dose to prevent decreased absorption? Option A, orange juice. Option B, apple juice. Option C, hot tea.
Correct answer C. Tannins found in tea and polyphenols in coffee bind to iron and significantly inhibit its absorption. Vitamin C, found in orange juice, actually enhances iron absorption. A patient is prescribed potassium chloride 20 MEQEQ-ER tablets. The patient mentions they have trouble swallowing large pills and asks if they can crush them. What is the correct response? Option A. Yes, as long as it is mixed with a small amount of applesauce. Option B. No, crushing the tablet will cause a dose dump and may lead to GI ulcers or cardiac arrest. Option C. Yes, but only if they drink 12 ounces of water immediately after. Option D. No, but the tablet can be chewed if done quickly. Correct answer B. Potassium chloride ER is a wax matrix or microencapsulated system. Crushing it destroys the extended release mechanism, leading to a dangerous spike in potassium, arrhythmia risk, and localized GI irritation, ulceration. A patient presents a prescription for methylphenidate Ritalin 10 milligrams. According to federal law, CSA, which of the following is true regarding refills for this medication? Option A. It can have up to 5 refills within 6 months. Option B. It can be refilled for up to 1 year from the date of issue. Option C. Refills are strictly prohibited for Schedule II substances. Option D. It can have 1 refill if the physician writes PRN on the script. Correct answer C. Methylphenidate is a Schedule II, C2 controlled substance. Under the Controlled Substances Act, C2 prescriptions cannot be refilled. A new original prescription is required for every fill. Which ADHD medication is a non-stimulant, selective norepinephrine reuptake inhibitor and carries a black box warning for increased suicidal ideation in children and adolescents? Option A. Amphetamine salts. Option B. Methylphenidate. Option C. Atomoxetine. Correct answer C. Atomoxetine, Strattera, is a non-stimulant. Unlike stimulants, it is not a controlled substance, but it shares the suicidal ideation warning common to many antidepressants due to its SNRI-like mechanism. A patient is taking donepezil 10 milligrams at bedtime for Alzheimer's disease. What is the most common side effect the technician should warn the patient about? Option A. Hypertension. Option B. Insomnia and vivid dreams. Option C. Constipation. Correct answer B. Donepezil is an acetylcholinesterase inhibitor. By increasing acetylcholine, it often causes GI upset, diarrhea, nausea, and CNS stimulation, leading to insomnia or abnormal dreams. A patient is prescribed testosterone cypionate injection. This medication is classified under which DEA schedule? Option A, Schedule II. Option B, Schedule III. Option C, Schedule IV. Option D, Schedule V. Correct answer B. Anabolic steroids, including testosterone, are classified as Schedule III, C3 substances due to their potential for abuse and physical psychological dependence. A patient taking ropinirole for Parkinson's disease reports falling asleep suddenly during daily activities, including driving. This phenomenon is known as Option A, tardive dyskinesia. Option B, sleep attacks. Option C, akathisia. Option D, retrograde amnesia. Correct answer B. Dopamine agonists like ropinirole and pramipexole
are associated with sudden onset sleep attacks without warning, which is a major safety concern for patients operating machinery. A patient is prescribed baclofen for muscle spasticity. What is the most dangerous consequence of abruptly stopping this medication? Option A, severe diarrhea. Option B, rebound spasticity, hallucinations and seizures. Option C, permanent hearing loss. Option D, acute hair loss. Correct answer, B. Abrupt withdrawal from baclofen can lead to a withdrawal syndrome characterized by high fever, altered mental status, exaggerated rebound spasticity, and life-threatening seizures. Which of the following skeletal muscle relaxants is an alpha-2 adrenergic agonist and carries a risk of significant hypotension and bradycardia? Option A, tizanidine. Option B, cyclobenzaprine. Option C, baclofen. Option D, methocarbamol. Correct answer A. Tizanidine Xanaflex is chemically related to clonidine. It reduces spasticity through alpha-2 agonism, which can cause dose-dependent drops in blood pressure and heart rate. A patient is prescribed memantine for moderate to severe Alzheimer's. What is its unique mechanism of action compared to donepezil? Option A, it is a cholinesterase inhibitor. Option B, it is an NMDA receptor antagonist. Option C, it increases dopamine production in the substantia nigra. Option D, it blocks serotonin reuptake. Correct answer, B. Memantine. Namenda works by regulating glutamate activity at the NMDA receptor to prevent overexcitation of neurons, whereas donepezil increases acetylcholine levels. A patient presents a prescription for levonorgestrel, Plan B one-step. Within what time frame must this be taken after unprotected intercourse to be most effective? Option A, 12 hours. Option B, 72 hours. Option C, 7 days. Correct answer, B. While it may have some efficacy up to 5 days, Plan B is FDA approved for use within 72 hours, 3 days of unprotected sex or contraceptive failure. A patient is taking estradiol for menopausal symptoms. If the patient still has an intact uterus, which other hormone must be added to reduce the risk of endometrial cancer? Option A, testosterone. Option B, progestin, e.g. medroxyprogesterone. Option C, HCG. Option D, oxytocin. Correct answer, B. Unopposed estrogen therapy in women with a uterus significantly increases the risk of endometrial hyperplasia and cancer. A progestin is added to protect the uterine lining. A patient on cyanocobalamin, vitamin B12 therapy, is most likely being treated for which condition? Option A, iron deficiency anemia. Option B, pernicious anemia. Option C, scurvy. Option D, rickets. Correct answer, B. Pernicious anemia is caused by a lack of intrinsic factor, preventing the absorption of B12. Vitamin B12, cyanocobalamin, is the treatment of choice, often given via injection to bypass the GI tract. A pregnant patient is prescribed folic acid 800 micrograms. What is the primary purpose of this supplement during pregnancy? Option A, to prevent gestational diabetes. Option B, to reduce the risk of neural tube defects, e.g. spina bifida. Option C, to increase the baby's birth weight. Option D, to prevent morning sickness.
Correct answer, B. Folic acid is critical for DNA synthesis and spinal cord development. Deficiency during early pregnancy is a leading cause of neural tube defects. Which of the following is a common side effect of magnesium oxide that often leads to its use as a laxative? Option A, constipation. Option B, diarrhea. Option C, tinnitus. Option D, photosensitivity. Correct answer, B. Magnesium salts are osmotic laxatives. They draw water into the intestines, which softens the stool and induces a bowel movement. Diarrhea is the most common side effect when used as a supplement. A patient is taking pramipexole. In addition to Parkinson's disease, what is the other FDA-approved indication for this drug? Option A, restless leg syndrome, RLS. Option B, ADHD. Option C, bipolar disorder. Option D, chronic migraine. Correct answer, A. Dopamine agonists like pramipexole, Mirapex, and ropinirole, Requip, are commonly used at lower doses to treat the symptoms of moderate to severe RLS. A patient is starting guanfacine ER, Intuniv, for ADHD. The technician should warn the patient that this medication should not be taken with Option A, a high-fat meal. Option B, orange juice. Option C, plain water. Option D, green leafy vegetables. Correct answer, A. High-fat meals significantly increase the absorption, Cmax and AUC of guanfacine ER, which can lead to increased side effects like extreme sedation and hypotension. A patient taking amphetamine salts, Adderall, reports feeling heart racing and jittery. These side effects are due to the drug's effect on which neurotransmitter? Option A, serotonin. Option B, norepinephrine. Option C, GABA. Option D, glycine. Correct answer, B. Amphetamines increase the release of both dopamine and norepinephrine. Norepinephrine's effect on the peripheral nervous system causes the fight or flight responses like tachycardia and nervousness. A patient is prescribed medroxyprogesterone, Depo-Provera injection. How often is this medication typically administered for contraception? Option A, once a month. Option B, every 3 months, 13 weeks. Option C, once a year. Option D, every 5 years. Correct answer B. Depo-Provera is a long-acting progestin-only contraceptive injection given deep IM or SQ every 3 months. Which of the following is a potential side effect of long-term testosterone replacement therapy that requires regular blood monitoring? Option A, anemia. Option B, polycythemia, elevated red blood cell count. Option C, hypoglycemia. Option D, hypotension. Correct answer, B. Testosterone can stimulate the production of red blood cells. If the hematocrit hemoglobin levels get too high, polycythemia, it increases the risk of blood clots and stroke. A patient is picking up risedronate 35 milligrams. The SIG says 1 tab POQ week. Why is this medication dosed weekly instead of daily? Option A, it is toxic if taken daily. Option B, it has a very long half-life in the bone tissue. Option C, it is too expensive for daily use. Option D, it only works on Sundays. Correct answer, B.
Bisphosphonates bind strongly to the bone mineral, hydroxyapatite, and stay there for years. Weekly dosing is as effective as daily dosing and significantly reduces the risk of GI side effects. A patient is prescribed a multivitamin with fluoride for their child. What is the primary reason for including fluoride? Option A, to prevent iron deficiency anemia. Option B, to strengthen tooth enamel and prevent dental caries. Option C, to improve the taste of the vitamins. Option D, to aid in the absorption of vitamin C. Correct answer, B. Fluoride is essential for dental health, particularly in areas where the water supply is not fluoridated, as it helps harden tooth enamel against acid-producing bacteria. A patient taking donepezil is prescribed a new medication for overactive bladder, e.g. oxybutynin. Why is this combination a concern? Option A, they are both stimulants. Option B, oxybutynin, anticholinergic, will antagonize the effects of donepezil, cholinergic. Option C, both drugs cause severe diarrhea. Option D, the combination causes immediate kidney failure. Correct answer, B. This is a classic prescribing cascade, or therapeutic antagonism. Donepezil works by increasing acetylcholine, while oxybutynin blocks it. Taking both essentially cancels out the benefits of the Alzheimer's medication. A patient is prescribed fentanyl 25 micrograms per hour, transdermal patches. Which of the following is a critical safety instruction regarding the disposal of used patches? Option A, place the patch in the regular household trash immediately. Option B, fold the patch in half with the adhesive sides together and flush down the toilet. Option C, leave the patch on the skin for at least 7 days before removing. Option D, cut the patch into small pieces before throwing it away. Correct answer, B. Because fentanyl is a highly potent Schedule II narcotic, even used patches contain enough medication to be fatal to a child or pet. The FDA recommends folding and flushing, or using a dedicated Sharps drug take-back bin to prevent accidental exposure. Cutting the patch is dangerous, as it releases the medication all at once. A patient is prescribed bimatoprost 0.03% ophthalmic solution for glaucoma. Which cosmetic side effect should the patient be counseled on? Option A, blue discoloration of the sclera. Option B, increased eyelash growth and darkening of the iris. Option C, permanent loss of eyebrow hair. Option D, yellowing of the eyelids. Correct answer, B. Prostaglandin analogs like bimatoprost and latanoprost can cause increased length, thickness, and pigmentation of eyelashes, as well as a permanent increase in brown iris pigmentation. A patient presents a prescription for carisoprodol. Which of the following is a unique characteristic of this muscle relaxant regarding its metabolism? Option A, it is excreted entirely unchanged by the kidneys. Option B, it is metabolized into meprobamate, a Schedule IV sedative. Option C, it bypasses the liver entirely. Option D, it is a prodrug that must be activated by stomach acid. Correct answer, B. Carisoprodol soma is a Schedule IV controlled substance because its primary metabolite is meprobamate, which has sedative hypnotic properties and a high potential for abuse and physical dependence. A patient is taking timolol ophthalmic drops for ocular hypertension. Which systemic condition in the patient's history would require the pharmacist to intervene? Option A, osteoarthritis. Option B, asthma or bradycardia. Option C, hyperthyroidism. Option D, seasonal allergies. Correct answer, B. Timolol is a non-selective beta blocker. Even when administered topically in the eye, enough can be absorbed systemically to cause bronchospasm in asthmatics or worsen bradycardia, slow heart rate. A patient is picking up a prescription for benzonatate. What is the most important administration instruction to prevent life-threatening choking or paradoxical bronchospasm? Option A, dissolve the capsule in hot tea. Option B, swallow the capsule whole, do not chew or break. Option C, take with a spoonful of honey. Option D, crush and mix with pudding. Correct answer, B. Benzonatate Tessalon perlase is a local anesthetic. If the capsule is chewed or dissolved in the mouth, it can numb the pharynx and larynx, leading to airway compromise or severe hypersensitivity reactions. A patient is being treated for opioid use disorder with buprenorphine. What is the purpose of the naloxone component in the combination product Suboxone? Option A, to provide additional pain relief. Option B, to prevent the patient from experiencing constipation. Option C, to discourage intravenous abuse by causing withdrawal if injected. Option D, to increase the absorption of buprenorphine. Correct answer C. Naloxone has very poor oral bioavailability. If taken sublingually as intended, it has no effect. However, if the tablet/film is crushed and injected, the naloxone becomes active and triggers immediate withdrawal symptoms in opioid-dependent individuals. A patient with chronic pain is switched from hydrocodone acetaminophen to morphine ER. Which side effect is non-tolerant, meaning it persists regardless of how long the patient takes the opioid? Option A, nausea. Option B, sedation. Option C, constipation. Option D, respiratory depression. Correct answer, C. While most patients develop tolerance to the sedative and nauseating effects of opioids, they rarely develop tolerance to opioid-induced constipation, OIC. A bowel regimen is almost always required for chronic users. A patient is prescribed latanoprost eye drops. Where should the patient be instructed to store the unopened bottles? Option A, in the freezer. Option B, in the refrigerator. Option C, in a warm, humid environment. Option D, in direct sunlight on a windowsill. Correct answer, B. Unopened bottles of latanoprost should be stored under refrigeration. Once opened, the bottle may be stored at room temperature for up to 6 weeks. Which of the following is an antidote used in the emergency reversal of an opioid overdose? Option A, naltrexone. Option B, naloxone. Option C, flumazenil. Option D, methadone. Correct answer, B. Naloxone, Narcan, is a short-acting opioid antagonist used to reverse respiratory depression during an overdose. Naltrexone is used for long-term maintenance/cravings and cannot be used for acute reversal. A patient is prescribed diazepam for acute muscle spasms. Which of the following is the DEA schedule for this medication? Option A, Schedule 2. Option B, Schedule 3. Option C, Schedule 4. Option D, Schedule 5. Correct answer, C. All benzodiazepines, including diazepam, temazepam, and alprazolam, are classified as Schedule 4 (CIV) controlled substances. A patient is taking dorzolamide, timolol, Cosopt. What is the mechanism of action of the dorzolamide component? Option A, prostaglandin agonist. Option B, alpha-2 agonist. Option C, carbonic anhydrase inhibitor. Option D, cholinergic agonist. Correct answer, C. Dorzolamide is a carbonic anhydrase inhibitor. By inhibiting this enzyme in the ciliary body of the eye, it decreases the production of aqueous humor, thereby lowering intraocular pressure. A patient is prescribed zolpidem for short-term insomnia. Which of the following is a unique safety warning associated with this Z drug? Option A, complex sleep behaviors, e.g. sleep driving or sleep eating. Option B, permanent loss of taste. Option C, severe orange discoloration of sweat. Option D, increased risk of tendon rupture. Correct answer, A. Zolpidem, Ambien, Ezapicolone, and Zalopon carry a boxed warning regarding complex sleep behaviors. Patients have reported performing activities while not fully awake, often with no memory of the event. Which of the following auxiliary labels should be placed on a bottle of guaifenesin ER Mucinex? Option A, take with a full glass of water. Option B, avoid dairy products. Option C, may cause blue-green urine. Option D, avoid exposure to sunlight. Correct answer, A. Guaifenesin is an expectorant. It works by thinning bronchial secretions, and its effectiveness is significantly enhanced by proper systemic hydration. A patient is using nicotine patches. Step 1, 21 milligrams. What is the correct way to rotate the application sites? Option A, apply a new patch to the same spot every day for consistency. Option B, apply a new patch to a different hairless area each day. Option C, apply the patch to the same area but flip it upside down. Option D, only apply the patch to the soles of the feet. Correct answer, B. Nicotine patches should be applied to a clean, dry, hairless area of the skin. Sites should be rotated daily to prevent skin irritation and ensure consistent absorption. Which of the following medications is a topical immunomodulator used for chronic dry eye, keratoconjunctivitis sicca? Option A, olopatadine. Option B, cyclosporin. Option C, brimonidine. Option D, ketotifen. Correct answer B. Cyclosporine, Restasis, is used to increase tear production in patients whose tear production is presumed to be suppressed due to ocular inflammation. A patient is prescribed brimonidine ophthalmic solution. What is its drug class? Option A, beta blocker. Option B, alpha-2 adrenergic agonist. Option C, carbonic anhydrase inhibitor. Option D, mast cell stabilizer. Correct answer, B. Brimonidine alpha-Gen P is an alpha-2 agonist. It works by both decreasing aqueous humor production and increasing uveoscleral outflow. A patient is using olopatadine drops for itchy eyes. What is the pharmacological advantage of this medication? Option A, it is a combination antihistamine and mast cell stabilizer. Option B, it is a topical steroid that doesn't cause cataracts. Option C, it permanently cures allergies. Option D, it must only be used once a month. Correct answer, A. Olopatadine, Patanol, Pataday, has a dual mechanism. It blocks H1 receptors, antihistamine, and prevents the release of inflammatory mediators from mast cells, stabilizer. A patient is prescribed methocarbamol for back pain. What is a common harmless side effect regarding urine color the patient should be aware of? Option A, bright red. Option B, brown, black, or dark green. Option C, neon yellow. Option D, milky white.
Correct answer B. Methocarbamol, Robaxin, can cause a harmless discoloration of urine, brown, black, green, that may alarm patients if they are not forewarned.
Which of the following sleep hygiene supplements is a hormone naturally produced by the pineal gland? Option A, ezopiquolone. Option B, melatonin. Option C, temazepam. Option D, diphenhydramine.
Correct answer B. Melatonin is an endogenous hormone that regulates the sleep-wake cycle. It is available over the counter as a supplement. A patient is prescribed ezopiquolone for sleep. What is a common bothersome side effect specifically associated with this medication? Option A, metallic, bitter taste in the mouth, dysgeusia. Option B, excessive hair growth on the face. Option C, significant weight loss. Option D, sensitivity to loud noises.
Correct answer A. Ezopiquolone, Lunesta, is notorious for causing a persistent bitter or metallic taste in the mouth, which is often reported by patients the morning after use. A patient is taking oxycodone acetaminophen 5/325 milligrams. If the patient is also taking OTC Tylenol extra strength, what is the primary safety risk? Option A, opioid overdose. Option B, acute hepatotoxicity, liver failure. Option C, acute renal failure. Option D, serotonin syndrome. Correct answer B. Many patients do not realize that APAP or acetaminophen is present in their prescription painkillers. Combining them with OTC acetaminophen can easily exceed the 4G per day limit, leading to liver damage.
A patient is prescribed naltrexone.
What is a prerequisite before a patient can safely start this medication for opioid use disorder? Option A, they must be actively using opioids to prevent withdrawal. Option B, they must be opioid-free for 7 to 10 days to avoid precipitated withdrawal. Option C, they must take a dose of naloxone first. Option D, they must have a high-fiber diet. Correct answer B. Naltrexone is a long-acting opioid antagonist. If it is given while opioids are still in the patient's system, it will displace them from the receptors and cause immediate, severe withdrawal. Which medication in the provided list is an antihistamine with mast cell stabilizing properties used for allergic conjunctivitis? Option A, ketotifen. Option B, bimatoprost. Option C, timolol. Option D, dorzolamide. Correct answer A. Ketotifen Zaditor is an OTC ophthalmic antihistamine and mast cell stabilizer, similar in function to olopatadine.
A patient is prescribed temazepam for sleep. This medication is primarily indicated for Option A, long-term management of anxiety. Option B, short-term treatment of insomnia. Option C, treatment of narcolepsy.
Correct answer B. Temazepam Restoril is a benzodiazepine primarily used for the short-term treatment of insomnia due to its intermediate onset and duration of action. A patient is picking up a refill for morphine sulfate ER. Which of the following is a common sign of opioid toxicity, overdose, that a caregiver should be trained to recognize? Option A, mydriasis, dilated pupils. Option B, pinpoint pupils and shallow breathing. Option C, rapid deep breathing. Option D, extreme hyperactivity. Correct answer, B. The opioid triad of overdose symptoms includes CNS depression, coma, respiratory depression, shallow slow breathing, and meiosis, pinpoint pupils. A patient with type 1 diabetes is found unconscious and clammy. A family member is instructed to administer a glucagon emergency kit. What is the physiological mechanism of this medication? Option A, it causes the pancreas to secrete massive amounts of insulin. Option B, it stimulates the liver to convert stored glycogen into glucose. Option C, it slows the digestion of carbohydrates in the small intestine. Option D, it increases the excretion of glucose through the kidneys. Correct answer, B. Glucagon is a hormone that opposes insulin. In severe hypoglycemia, it triggers glycogenolysis, breakdown of glycogen, and gluconeogenesis in the liver to rapidly raise blood sugar. Which of the following insulin types is cloudy in appearance and must be gently rolled or inverted before being drawn into a syringe? Option A, insulin aspart. Option B, insulin regular. Option C, insulin NPH. Option D, insulin detamere. Correct answer, C. NPH, neutral protamine hagedorn, is an intermediate-acting insulin. It is a suspension, which gives it a cloudy appearance. It must be resuspended by rolling to ensure an accurate dose. The others are clear solutions. A patient is picking up a prescription for empagliflozin based on its mechanism as an SGLT2 inhibitor. Which of the following is a common and specific side effect? Option A, upper respiratory tract infections. Option B, genital mycotic fungal infections. Option C, permanent discoloration of the teeth. Option D, severe constipation. Correct answer, B. SGLT2 inhibitors like empagliflozin, dapagliflozin, and canagliflozin work by increasing glucose excretion in the urine, glycosuria. This high sugar content in the urinary tract provides a breeding ground for yeast and bacteria. A patient taking digoxin 0.125 milligrams daily reports seeing yellow-green halos around lights and experiencing nausea. Which lab value is most critical to check immediately? Option A, serum sodium. Option B, serum potassium. Option C, serum magnesium. Option D, hemoglobin A1C. Correct answer B. Hypokalemia low potassium significantly increases the risk of digoxin toxicity. Visual changes, halos, and GI distress are classic signs of toxicity. While digoxin levels are also checked, potassium levels are the primary trigger for this interaction. Which medication used for dyslipidemia is known to cause significant cutaneous flushing, which can be mitigated by taking an aspirin 30 minutes prior to the dose? Option A, ezetimibe. Option B, fenofibrate. Option C, niacin. Option D, gemfibrozil. Correct answer, C. Niacin, nicotinic acid, causes prostaglandin-mediated vasodilation, leading to intense flushing and itching. Aspirin and NSAID inhibits prostaglandin synthesis, reducing this effect.
A patient is prescribed amiodarone for atrial fibrillation. Which of the following organ systems requires baseline and periodic monitoring due to the drug's high iodine content and potential for blue-gray skin discoloration? Option A, renal system. Option B, thyroid system. Option C, pancreas. Option D, auditory system. Correct answer, B. Amiodarone is structurally related to thyroxine and contains iodine. It can cause both hyperthyroidism and hypothyroidism. It also carries risks for pulmonary fibrosis and hepatotoxicity. A patient presents a prescription for pseudoephedrine. According to the Combat Methamphetamine Epidemic Act, CMEA, what is the maximum amount an individual can purchase in a single 30-day period? Option A, 3.6 grams. Option B, 7.5 grams. Option C, 9.0 grams. Option D, 15 grams. Correct answer, C. Federal law limits the retail sale of pseudoephedrine to 3.6 grams per day and 9.0 grams per 30-day period to prevent the illegal manufacture of methamphetamine. Which of the following is a non-dihydropyridine calcium channel blocker that is used to control heart rate and can cause significant constipation? Option A, amlodipine. Option B, diltiazem. Option C, nifedipine. Option D, felodipine. Correct answer, B. Diltiazem and verapamil are non-DHPs. Unlike the dipines, they act on the AV node of the heart to slow the rate. Constipation is a hallmark side effect, especially with verapamil, diltiazem. A patient is prescribed liraglutide, Victoza, for type 2 diabetes. What is the primary black box warning associated with the GLP-1 agonist class? Option A, risk of heart failure. Option B, risk of thyroid C-cell tumors. Option C, risk of tendon rupture. Option D, risk of lactic acidosis. Correct answer, B. GLP-1 receptor agonists like liraglutide, semaglutide, and dulaglutide have a BBW for a personal or family history of medullary thyroid carcinoma, MTC, or multiple endocrine neoplasia syndrome type 2, MEN2. A patient is taking cholestyramine for high cholesterol. How should the technician advise the patient to schedule their other oral medications? Option A, take all other medications at the same time for convenience. Option B, take other medications 1 hour before or 4 to 6 hours after cholestyramine. Option C, take other medications with a high-fat meal. Option D, dissolve all medications in the same glass of water. Correct answer, B. Cholestyramine is a bile acid sequestrant. It is a nonspecific resin that binds to many other drugs, like warfarin, digoxin, and levothyroxine, in the gut, preventing their absorption. Spacing is required. A patient is using oxymetazoline Afrin nasal spray for congestion. What is the maximum number of days the patient should use this to avoid rhinitis medicamentosa, rebound congestion? Option A, 3 days. Option B, 7 days. Option C, 14 days. Correct answer, A. Prolonged use, typically more than 3 to 5 days, of topical nasal decongestants leads to downregulation of alpha receptors, causing the nasal passages to swell shut once the drug wears off. Which medication is a fibrate that is strictly contraindicated for concurrent use with simvastatin due to a significantly increased risk of rhabdomyolysis? Option A, ezetimibe. Option B, gemfibrozil. Option C, niacin. Option D, cholestyramine. Correct answer, B, gemfibrozil inhibits the glucuronidation of statins, leading to toxic levels of the statin in the blood. Fenofibrate is generally preferred if a fibrate-statin combination is necessary. A patient is prescribed insulin aspart. What is the onset of action for this insulin? Option A, 15 minutes. Option B, 60 minutes. Option C, 2 hours. Option D, 4 hours. Correct answer, A. Insulin aspart, Novolog, is a rapid-acting insulin. It begins working within 10-20 minutes, which is why it must be administered immediately before or after a meal. Which of the following medications is a GLP-1 agonist that is administered once weekly via subcutaneous injection? Option A, liraglutide. Option B, semaglutide, Ozempic. Option C, insulin regular. Option D, diltiazem. Correct answer, B. Semaglutide, Ozempic, and dulaglutide Trulicity are once-weekly injections. Liraglutide Victoza is administered once daily. A patient is taking digoxin. The pharmacist mentions that the drug has a narrow therapeutic index. What does this mean? Option A, the drug is only effective in a very small number of patients. Option B, the difference between a therapeutic dose and a toxic dose is very small. Option C, the tablet is physically very small and hard to handle. Option D, the drug only works on a narrow section of the heart. Correct answer, B. Narrow therapeutic index, NTI drugs, require precise dosing and blood monitoring because slight changes in concentration can lead to treatment failure or severe toxicity. Which of the following is a long-acting basal insulin that provides a steady release of insulin over 24 to 42 hours? Option A, insulin regular. Option B, insulin NPH. Option C, insulin degludec. Option D, insulin aspart. Correct answer, C. Insulin degludec. Tresiba is an ultra-long-acting insulin with a duration of action that can exceed 42 hours, providing a very stable basal rate. A patient is prescribed fenofibrate. What is the primary clinical indication for this medication? Option A, lowering LDL cholesterol only. Option B, lowering high triglycerides. Option C, treating type 1 diabetes. Option D, controlling cardiac arrhythmias. Correct answer B. Fibrates are primarily used to lower triglycerides and increase HDL. They are less effective at lowering LDL compared to statins. A patient is experiencing an anaphylactic reaction. Which concentration of epinephrine is typically used for intramuscular IM injection? Option A, 1 to 100, 10 milligrams per milliliter. Option B, 1 to 1,000, 1 milligrams per milliliter. Option C, 1 to 10,000, 0.1 milligrams per milliliter. Option D, 1 to 100,000, 0.01 milligrams per milliliter. Correct answer, B. The standard concentration for IM epinephrine, like in an EpiPen, is 1 to 1,000. The 1 to 10,000 concentration is typically reserved for IV use during cardiac arrest. Dextromethorphan is chemically related to opioids, but lacks analgesic properties.
What is its primary indication? Option A, pain relief. Option B, cough suppression, antitussive. Option C, decongestion. Option D, fever reduction. Correct answer, B. Dextromethorphan acts on the cough center in the medulla to increase the cough threshold. At high doses, it can cause dissociative hallucinations. A patient taking ezetimibe, Zetia, asks how the drug works compared to their atorvastatin. What is the correct explanation? Option A, it inhibits cholesterol synthesis in the liver. Option B, it inhibits the absorption of cholesterol in the small intestine. Option C, it causes the body to sweat out excess fat. Option D. Correct answer B. Ezetimibe specifically targets the NPC1L1 protein in the small intestine to block the absorption of dietary and biliary cholesterol. Statins inhibit cholesterol production in the liver. A patient is prescribed phenylephrine nasal spray. Why is this drug often considered less effective than pseudoephedrine when taken orally? Option A, it is destroyed by stomach acid. Option B, it undergoes extensive first-pass metabolism in the gut-liver. Option C, it only works on patients with a specific genetic marker. Option D, it is too large to be absorbed by the intestines. Correct answer, B. Oral phenylephrine has very low bioavailability, about 38%, due to metabolism in the gut wall and liver, making it significantly less effective as a systemic decongestant than pseudoephedrine. Which of the following is a common side effect of amiodarone that can result in a slate blue skin color in areas exposed to the sun? Option A, photosensitivity. Option B, jaundice. Option C, cyanosis. Option D, vitiligo. Correct answer, A. Amiodarone causes photosensitivity. Long-term use can lead to a distinctive blue-gray skin pigmentation in sun-exposed areas, which may only partially resolve after stopping the drug. A patient is prescribed canagliflozin. The pharmacist must counsel the patient on an increased risk of which serious complication associated with the specific SGLT2 inhibitor. Option A, hearing loss. Option B, lower limb amputations. Option C, hair loss. Option D, vitamin B12 deficiency. Correct answer, B. In clinical trials, Canvas, canagliflozin was associated with an increased risk of leg and foot amputations, leading to a specific warning for patients with peripheral vascular disease or neuropathy. When mixing insulin in one syringe, what is the correct order of draw to prevent contaminating the clear insulin with the cloudy insulin? Option A, cloudy NPH, then clear regular. Option B, clear regular, then cloudy NPH. Option C, it does not matter as long as the total units are correct. Option D, they should never be mixed in the same syringe. Correct answer B. The clear before cloudy rule ensures that the fast-acting clear insulin remains pure. If NPH, cloudy, gets into the regular vial, it can change the onset time of the regular insulin. A patient is prescribed diltiazem CD. What does the CD suffix usually indicate? Option A, constant dose. Option B, controlled delivery, extended release. Option C, cardiac dose. Option D, chewable daily. Correct answer, B. CD, XR, XL, and ER are suffixes indicating that the medication is designed for extended release. Diltiazem CD is typically taken once daily, whereas immediate release diltiazem is taken multiple times a day. A patient is prescribed clonidine patches, Catapress TTS. Which of the following is a critical safety instruction for the patient regarding the removal of the old patch? Option A. Always wash the area with alcohol immediately after removal. Option B. Fold the used patch in half with the adhesive sides together before disposal. Option C. Leave the old patch on for 24 hours after applying the new one to ensure coverage. Option D. Wear the patch only during the day and remove it at bedtime. Correct answer B. Like many transdermal medications, used clonidine patches contain residual drug that can be toxic to children or pets. Folding the patch helps prevent accidental exposure. Applying two patches simultaneously, option C, could lead to severe hypotension or bradycardia. A patient is being switched from enoxaparin injections to apixaban tablets. What is the pharmacological class of apixaban? Option A, direct thrombin inhibitor. Option B, vitamin K antagonist. Option C, factor Xa inhibitor. Option D, low molecular weight heparin. Correct answer C. Apixaban Eliquis and rivaroxaban Xarelto are direct oral anticoagulants, DOACs, that specifically inhibit factor Xa. Dabigatran is a direct thrombin inhibitor. A patient taking spironolactone 50 mg daily is prescribed a salt substitute by a nutritionist. Why should the pharmacy technician flag this for the pharmacist? Option A. Salt substitutes are high in sodium and will raise blood pressure. Option B. Salt substitutes often contain potassium chloride, increasing the risk of hyperkalemia. Option C. Salt substitutes prevent spironolactone from being absorbed. Option D. Spironolactone makes salt substitutes taste metallic. Correct answer B. Spironolactone is a potassium-sparing diuretic. Most salt substitutes replace sodium with potassium. Combining them can lead to life-threatening hyperkalemia, high potassium. A patient is picking up nitroglycerin sublingual tablets. What is the correct advice regarding the storage of this medication to maintain its potency? Option A. Transfer the tablets to a convenient weekly pill organizer. Option B. Keep the tablets in their original amber glass bottle and replace the cap tightly. Option C. Store the bottle in the refrigerator to prevent evaporation. Option D. Keep the tablets in a plastic baggie in a pocket for quick access. Correct answer B. Nitroglycerin is highly volatile and sensitive to light and moisture. It must be kept in its original glass bottle. Plastic containers can absorb the medication, and light will degrade it quickly. A patient is receiving heparin via IV infusion. Which laboratory test is most commonly used to monitor the therapeutic effectiveness and safety of unfractionated heparin? Option A, PTINR. Option B, APTT, activated partial thromboplastin time. Option C, serum creatinine. Option D, HbA1c. Correct answer B. The APTT test measures the time it takes for blood to clot and is the standard for monitoring unfractionated heparin. PTINR is used for warfarin. A patient is prescribed dabigatran, Pradaxa. Which of the following is a unique storage requirement for this medication's original manufacturer bottle? Option A. It must be stored in the freezer. Option B. It contains a desiccant, and the capsules must be used within 4 months of opening. Option C. The bottle must be shaken for 30 seconds before opening. Option D. It must be stored in a lead-lined container. Correct answer B. Dabigatran capsules are very sensitive to moisture. They must be kept in the original bottle, which has a desiccant cap, and discarded 4 months after the bottle is first opened.
A patient with a history of severe sulfa allergy is prescribed acetazolamide for altitude sickness.
Why is this a potential safety concern? Option A. Acetazolamide is a sulfonamide derivative and may cause cross-reactivity. Option B. Acetazolamide causes the body to retain sulfa drugs. Option C. It increases the risk of sulfa-induced kidney stones. Option D. There is no concern. Acetazolamide is a steroid. Correct answer A. Acetazolamide diamox is a carbonic anhydrase inhibitor and a non-bacteriostatic sulfonamide. Patients with sulfa allergies may experience cross-reactivity, including severe rashes. Which of the following is a vasodilator used in hypertensive emergencies that can cause lupus-like syndrome with long-term use? Option A, hydralazine. Option B, enalapril. Option C, atenolol. Correct answer A. Hydralazine is a direct-acting vasodilator. A unique and serious side effect of chronic high-dose therapy is drug-induced lupus erythematosus, DILE. A patient is prescribed ursodiol. What is the primary indication for this medication? Option A. To dissolve small gallstones in patients who cannot have surgery. Option B. To treat acute bacterial infections of the liver. Option C. To lower high blood pressure. Option D. To prevent migraine headaches. Correct answer A. Ursodiol, Actigol, is a naturally occurring bile acid that helps decrease the cholesterol content of bile, allowing for the gradual dissolution of cholesterol-based gallstones. Which of the following anticoagulants is administered via subcutaneous injection and is calculated based on the patient's weight? Option A, rivaroxaban. Option B, enoxaparin. Option C, dabigatran. Option D, isosorbide mononitrate. Correct answer, B. Enoxaparin Lovenox is a low molecular weight heparin, LMWH. Dosing for conditions like DVT treatment is typically 1 mg/kg or 1.5 mg/kg, administered subcutaneously. A patient presents a prescription for enalapril. Which side effect is most closely associated with the accumulation of bradykinin in the lungs? Option A, peripheral edema. Option B, dry, persistent cough. Option C, yellowing of the eyes. Option D, insomnia. Correct answer, B. ACE inhibitors like enalapril and ramipril prevent the breakdown of bradykinin. In some patients, this leads to a dry, non-productive cough that usually requires switching to an ARB. A patient is receiving mannitol via IV infusion for increased intracranial pressure. What is a specific requirement for the pharmacy technician when preparing this medication? Option A, it must be protected from all light with aluminum foil. Option B, it must be checked for crystals and administered with an inline filter. Option C, it must be mixed with a calcium-containing solution. Option D, it must be shaken vigorously until it foams.
Correct answer, B. Mannitol is a highly concentrated sugar solution that can crystallize at room temperature. It must be inspected for crystals and warmed if they are present, and always filtered during administration. A patient taking probenecid for gout is told to drink plenty of water. What is the reason for this recommendation? Option A, to prevent the drug from causing dry mouth. Option B, to prevent the formation of uric acid kidney stones. Option C, to help the drug dissolve in the stomach. Option D, to prevent the drug from causing weight gain. Correct answer, B. Probenecid is a uricosuric agent. It increases the excretion of uric acid in the urine. High concentrations of uric acid in the urine can lead to the formation of urate stones unless the urine is kept dilute. A patient is prescribed isosorbide mononitrate ER. What is the purpose of the nitrate-free interval, usually 10 to 12 hours, recommended for this medication? Option A, to prevent the patient from becoming addicted. Option B, to prevent the development of nitrate tolerance. Option C, to allow the liver to regenerate. Option D, to prevent the medication from causing insomnia. Correct answer, B. Continuous exposure to nitrates leads to tachyphylaxis or tolerance, where the drug loses its effectiveness. A nitrate-free period, usually overnight, allows the body to reset, so the drug works the next day. A patient with anemia is prescribed iron sucrose, Venofer, IV. Which of the following is a significant risk during the administration of IV iron products? Option A, sudden hypertension. Option B, anaphylaxis or hypersensitivity reactions. Option C, permanent skin bleaching. Option D, excessive hair growth. Correct answer, B. All IV iron products, including iron sucrose, carry a risk of severe hypersensitivity reactions, including anaphylaxis. Patients are often monitored closely during the infusion. Sodium bicarbonate is sometimes used in the emergency department for which of the following purposes? Option A, to treat severe metabolic acidosis. Option B, to lower high blood pressure. Option C, to treat a bacterial infection. Option D, to prevent blood clots. Correct answer, A. Sodium bicarbonate is an alkalizing agent. It is used to neutralize excess acid in the blood, acidosis, or to alkalinize the urine to help speed up the excretion of certain toxins, like aspirin. A patient taking atenolol reports feeling extremely tired and dizzy. The pharmacist checks the patient's pulse and finds it is 48 beats per minute. This condition is known as Option A, tachycardia. Option B, bradycardia. Option C, hypertension. Option D, tachypnea. Correct answer, B. Beta blockers like atenolol slow the heart rate. A heart rate below 60 beats per minute is defined as bradycardia. If the rate drops too low, it can cause fatigue and dizziness. A patient is prescribed ramipril for heart failure. Which of the following is a rare but life-threatening side effect involving swelling of the face, lips, and tongue? Option A, rhabdomyolysis. Option B, angioedema. Option C, Stevens-Johnson syndrome. Option D, ototoxicity. Correct answer, B. Angioedema is a rapid swelling of the deep layers of the skin and submucosa. With ACE inhibitors, it is a medical emergency because it can obstruct the airway. Which of the following is a potassium-sparing diuretic that is more selective than spironolactone and less likely to cause gynecomastia, breast enlargement in men?
Option A, eplerenone. Option B, hydralazine. Option C, clonidine. Option D, mannitol. Correct answer. A. Eplerenone, INSPRA, is a selective aldosterone receptor antagonist. Unlike spironolactone, it has a low affinity for androgen and progesterone receptors, significantly reducing hormonal side effects. A patient is taking verapamil for supraventricular tachycardia. Which beverage should they avoid because it can increase the drug's levels to a toxic range? Option A, milk. Option B, grapefruit juice. Option C, pomegranate juice. Option D, green tea. Correct answer. B. Verapamil is a substrate of the CYP3A4 enzyme. Grapefruit juice inhibits this enzyme, leading to higher than intended blood levels of verapamil, which can cause severe bradycardia or hypotension. Which of the following medications is a direct thrombin inhibitor that is available as an oral capsule? Option A, heparin. Option B, dabigatran. Option C, apixaban. Option D, rivaroxaban. Correct answer, B. Dabigatran Pradaxa is currently the only oral anticoagulant in its class, direct thrombin inhibitor. Apixaban and rivaroxaban are factor Xa inhibitors. A patient is prescribed propranolol for migraines. Which of the following describes the beta-1 effect of this medication? Option A, dilation of the pupils. Option B, decreased heart rate and contractility. Option C, relaxation of the bladder. Option D, increased glucose production. Correct answer B. Beta-1 receptors are located primarily in the heart. Stimulating them increases heart rate. Blocking them with a beta blocker decreases heart rate and the force of contraction. A patient is taking rivaroxaban, Xarelto, 20 mg daily. What is a specific administration requirement for this dose to ensure proper absorption? Option A, take on an empty stomach. Option B, take with the evening meal. Option C, take only with a full glass of milk. Option D, dissolve the tablet under the tongue. Correct answer, B. The 15 mg and 20 mg doses of rivaroxaban must be taken with food to ensure adequate absorption, bioavailability. The 10 mg dose can be taken with or without food. A patient is prescribed isosorbide mononitrate. Which of the following is a very common, though often temporary side effect during the first few days of therapy? Option A, constipation. Option B, headache. Option C, skin rash. Option D, hearing loss. Correct answer, B. Nitrates cause vasodilation, including the vessels in the brain. This frequently results in a nitrate headache. Patients are usually advised that this will diminish as they continue the medication. Which of the following electrolyte abnormalities is most commonly associated with loop diuretics such as furosemide? Option A, hyperkalemia. Option B, hypokalemia. Option C, hypercalcemia. Correct answer, B. Loop diuretics, e.g., furosemide, bumetanide, torsemide, inhibit the Na plus K plus 2Cl- transporter in the thick ascending loop of Henle, causing increased excretion of sodium, potassium, calcium, and water. Hypokalemia is one of the most common and clinically significant electrolyte disturbances associated with this drug class. Great work. Exams love to test top 200 drugs. Keep going through this playlist to reinforce brand names, generics, classes, and uses until recall becomes automatic. If this helped you, like the video and subscribe to MedPrepPrime for more pharmacist-led exam-focused practice. See you in the next set.